Hi everyone, my name is Emma, and today I'll be talking about functional neurological disorder, also known as FND. By the end of this presentation, all students and new clinicians should be able to define functional neurological disorder, or FND, and describe its prevalence, provide a basic overview of FND symptoms, and address common misconceptions and sources of stigma surrounding FND. And I bet you're asking, why does this even matter? Throughout this presentation, I want you to put yourself in this patient's shoes. This is Lisa. Before the onset of her FND, she was a healthy 43-year-old female. She had a full-time job and was very active in her community. She was a mom and she often went to the school to support her kids in school functions. And this is Lisa after the onset of her FND. She was unable to live her life as she did before. She was in a wheelchair and couldn't walk without an assistive walking device. Her job fired her due to her condition. She was unable to help in her community. She couldn't go to her kids' school events. And on top of that, she had a ton of new symptoms she had to navigate around. So before we dive into exactly what FND is, I thought it would be important to describe the difference between structural and functional neurological disorders. So if you look at this brain here, as you can see, there is no structural abnormalities. This is what a doctor would see if they took an image of a person's brain with FND. Whereas if someone had a stroke or a tumor or a lesion, there would be a structural difference here. So in FND, there is nothing physically wrong with the brain. Now, what exactly is FND? Well, FND is a neurological condition that changes how the brain networks communicate with each other. It is unable to send or receive signals properly. And there are two types of FND. There is functional motor movement disorder and functional or dissociative seizures. And the exact cause of this is all unknown. To help equate what this really means, I like to think of FND like a lamp with a loose plug. Nothing is broken, but the connection between the brain and the body isn't steady. So the light of the lamp would flicker even though all the parts are still there and capable of working. So as I just mentioned, FND is a brain network dysfunction. So the different parts of the brain aren't wired correctly. And this could cause a few different things for people with FND to struggle with. First off, we have emotional processing. So people with FND are going to have a hard time regulating emotions. And this hard time regulating emotions causes the emotional circuit to overly influence motor and sensory systems. Secondly, we have sense agency. So this contributes to movements that feel involuntary despite intact motor pathways. So unlike people with a spinal cord injury, the upper motor and lower motor neurons are intact. So they are fully functioning. Third, we have attention. So abnormalities in attention networks lead to excessive focus on symptoms and difficulty shifting attention away from bodily sensations. And then fourth, we have interoception. And this is altered processing of internal body signaling, such as heartbeat and breathing. And this may contribute to sensory symptoms such as dizziness and heightened bodily awareness. And last, we have predictive processing, and is the brain overriding sensory evidence. So this leads the brain to believe an abnormal movement is correct. So as you can see, there are a lot of motor symptoms. I would like to highlight just a few of these. So there is functional or dissociative seizures that cause seizure-like episodes that are caused by psychological or functional disruptions in the brain, and not by an abnormal electrical activity. I'd also like to clarify what drop attacks are. So drop attacks are sudden falls without loss of consciousness. Some other symptoms include gait disorders, dystonia, tics, tremors, and a bunch of other motor symptoms. So people with FND also experience sensory symptoms. Among these sensory symptoms, we have numbness and altered sensation. We have visual symptoms such as blurred vision, field loss, double vision, and visual snow. And we also have functional dizziness. So some other symptoms of FND include bladder and cognitive symptoms. These symptoms just did not fit under the sensory or motor categories, so they were put in the other category. And all the other symptoms that are not in bold are symptoms that are often experienced by people with FND, but are not part of the definition itself. So some of these other associated symptoms include fatigue, pain, anxiety, headaches, sleep problems, and a bunch of different other symptoms. So people with FND often experience quite a few biopsychosocial contributors. There was a study done that gave people a questionnaire that looked at medical issues, mental health, social stress, and daily functioning. And they found that 70% of patients with FND have a high biopsychosocial strain compared to people with stroke who had only 15%. So, compared to these stroke patients, people with FND often have more anxiety, more depression, more somatic symptoms such as pain, fatigue, dizziness. They have more disassociation and overall a low quality of life. People with FND can get better. Some positive factors include early, confident diagnosis with clear explanation to these patients. It is also crucial for the people around them to believe and support in them, whether it be family, friends, their community. It is also important for these people with FND to have a strong therapeutic alliance with all their healthcare workers. Some negative factors include chronic symptoms or a delay in diagnosis that lasts over a year. And as I mentioned earlier, people with FND, their emotions strongly correlate with their motor dysfunction. So if they have anxiety or they're stressed or the people around them just don't believe in them, their prognosis isn't going to be as great and they're less likely to go into remission. So anyone can develop FND, but it is more likely to develop in females than males. People who have had an adverse childhood or adult experience, such as trauma or bullying, are 2 to 4 times more likely to develop FND. Other health conditions are one of the more common risk factors as well. And I'm not saying that if you have one of these items on this list that you are going to develop FND. It is just a strong correlation. So there are a lot of common misconceptions surrounding FND, and the ones on the slide are only the tip of the iceberg. And if you believe these things, these cause a lot of hurt for people with FND. They can cause disbelief by clinicians. They are often fired from their job or have employment discriminations. They are socially excluded. They have driving restrictions. They have long diagnostic delays. There leads to a lack of FND trained clinicians. There's often outdated or harmful terminology, and FND is often not included in medical education. There's insurance and disability barriers, and all of these and more negatively impact people with FND, and it's all because of these common misconceptions. So I ask you again, why does it matter? It matters because Lisa and everyone with FND matters. It matters because their symptoms are real and deserve to be treated as such. It matters because it can happen to anyone. It can happen to you, it can happen to a coworker, it can happen to a loved one. And for me, it happened to my mom, Lisa, and she matters. And these are my references. And if you have any questions, feel free to reach out to me and I will answer them to the best of my ability.